The tasks of medical nuclear engineers involve the therapeutic and diagnostic applications of radionuclides, the equipment associated with their production, use, measurement, and evaluation, the quality of images resulting from their production and use, and the medical health physics associated with this subfield. Medical nuclear engineering careers can be divided into three sub-careers: nuclear medicine physicists, nuclear pharmacists, and nuclear medicine technologists. Specific tasks differ among each of these three careers. Nuclear medicine physicists' jobs are broken down into three fields: clinical service and consultation, research and development, and teaching. Medical physicists who are involved with clinical service and consultation collaborate with physicians who are responsible for diagnosis and treatment. Together, they investigate equipment performance and organize quality control and imaging systems, design of radiation installations, and control of radiation hazards. However, medical physicists are mostly needed to provide clinical and scientific advice and resources to solve the numerous and diverse physical problems that arise continually in many specialized medical areas. Nuclear medicine physicists play a very important role in medical research and development. Their tasks include developing new techniques for precise measurement of radiation, blood flow, and oxygenation. They also develop computer-based dose calculation for patient treatment, video display of this treatment information. Another task that medical physicists who focus on research and development do is record, correlate, and interpret bioelectric potentials of mentally ill patients. The research that is done as part of this job is on general medical significance, including the applications of digital computers in medicine and applications of information theory to diagnostic problems, processing, storing, and retrieving medical images, measuring the amount of radioactivity in the human body and foodstuffs, and studying the anatomical and temporal distribution of radioactive substances in the body. Medical physicists can also be involved in teaching at universities and colleges, where they help train future medical physicists, resident physicians, medical students, and technologists. They also conduct courses in medical physics and aspects of biophysics and radiobiology for a variety of graduate and undergraduate students.
I am a nuclear medicine physicist. I am the director of nuclear medicine physics at Children's Hospital Boston. I am also an associate professor of radiology at Harvard Medical School. I know about nuclear medicine instrumentation, radiation physics, and dosimetry. The doctors know about patients and medicine, and I know about instrumentation and radiation. Together, we make a good team.
Could you describe your typical workday? What are your daily tasks and responsibilities?
My day can be quite varied, which is what I love about my job. I may be teaching a class to radiologists training in nuclear medicine or technologist students training to perform the studies. I could be testing our equipment to make sure it is working appropriately. I could be processing a research study or writing a chapter for a new book on nuclear medicine. I do not do all of those things every day, but I do them every week.
Nuclear pharmacy is a specialty area of pharmacy practice dedicated to the compounding and dispensing of radioactive materials for use in nuclear medicine procedures, such as the diagnosis and treatment of specific ailments like cancer and heart disease. Nuclear pharmacists are the ones who order, store, and maintain strict inventory control of all radiopharmaceuticals, prepare drugs using radioisotopes, oversee some instruments and devices, and communicate information about radiation safety, radiopharmacology, and related activities. Nuclear medicine technologists aid in the diagnosis and treatment of certain diseases. Nuclear medicine technologists work directly with patients under the supervision of a physician on explaining the test procedures to patients, preparing a dosage of the radiopharmaceutical, and operating a gamma scintillation camera, or scanner, which creates pictures of the drug as it passes through parts of the patient's body. Nuclear medicine technologists must also keep records of patient treatments, equipment use and maintenance, and the amount and type of radiopharmaceuticals received, used, and disposed of. My group members and I have broken our study of medical nuclear engineering down into 3 primary occupations: nuclear medicine physicist, nuclear pharmacist, and nuclear medicine technologist. However, we welcome any and all insight about applications of nuclear engineering to medicine.
Although I understand that I am biased, without a physician leading the departments, those occupations would not exist. I would definitely add physician to the mix because usually those people work with nuclear medicine physicians and radiologists to allow departments of nuclear medicine to operate.
In summary, nuclear medicine physicists research and develop radiation-based treatments in nuclear medicine that are stored and prepared by nuclear pharmacists. These radiation-based materials and drugs are used by nuclear medicine physicists in working with physicians to design and supervise diagnosis and treatment plans. Finally, nuclear medicine technologists physically administer radiopharmaceuticals and operate radiation technology. In your opinion, what is the best aspect of your career as a nuclear medicine physicist?
I think the best part of my job is the diversity. I teach, I help in the clinic, I help bring new approaches online, I am involved in research projects. So every day is different. I am not stuck doing the same thing every day. I think my favorite aspect is teaching. Whether to doctors training in nuclear medicine or college students training to be nuclear medicine technologists, I often find myself teaching physics to students who did not find physics their most interesting subject. Many of them went into medicine because they liked biology more than physics, so it is a challenge for me to make what I teach relevant and accessible. I want to make sure they understand the material that I think is essential and that they are able to apply it appropriately in their day-to-day practice. That takes some skill, if I do say so myself.
In the words of my nuclear physics teacher, the lines between scientist, engineer, and technician can be somewhat blurry in many cases. How do you distinguish between these different titles and/or professions in nuclear medicine?
Part of my job is as a scientist when I work with investigators using nuclear medicine to address some interesting question. When I am evaluating either existing or new equipment, I am more of an engineer. I do not really see myself as a technician. I do not fix things, although I sometimes help figure out what is wrong with the equipment. Again, the diversity of what I do is what makes it so interesting.
In order to become a nuclear medicine physicist, one needs a college degree. A master's or doctoral degree is highly desirable. Along with education, a medical physicist needs non-academic training such as a residency traineeship or a postdoctoral program of 1 or 2 years in a hospital. The American Association of Physicists in Medicine defines a medical physicist as someone who, quote, assures the safe and effective delivery of radiation, unquote. This entails a lot of education and typically requires a license, for obvious reasons, as medical physicist jobs often involve protecting patients from overexposure to radiation. The basic degree for this occupation is a master's degree. This is an important difference from the qualifications necessary for a nuclear medical technologist, whose basic degree is a bachelor's. The qualifications necessary for this position, the nuclear medicine physicist, are much higher. This would most likely require classes involving physics, medical physics, anatomy, and biology. As a final qualification, a nuclear medicine physicist needs a license from the American Board of Radiology. This consists of 3 separate exams. The first exam can be taken immediately upon graduation. However, the second and third parts are more intensive and comprehensive. Part 2 of the exam requires at least 2 years of experiential training beyond obtaining the master's degree. After 2012, one must need to have completed a 2-year CAMPEP Commission for the Accreditation of Medical Physics Educational Programs approved residency program to qualify for the Part 2 exam. Finally, an oral exam can be taken in the year following the attainment of the second exam. This is usually done in June. After this process is complete, a person receives an ABR certification. Several skills are also necessary for a person to succeed in the occupation of nuclear medicine physicist. A good understanding of physics and medicine is necessary, as well as the principles of the kind of radiation used. Perhaps more importantly, a medical physicist needs to have good interpersonal and communication skills. They will be working with a large team of various doctors, nuclear medical technologists, radiation oncologists, nurses, and dosimetrists. They would also need a good bedside manner, as they will be working with and treating many different types of patients. What spurred your initial interest in nuclear medicine?
I was a physics major in college, but I wanted to put it to some kind of good use. Looking around, I found medical physics and nuclear medicine, and so I went to graduate school in medical radiological physics. It seemed like it would be fun since it used my physics and math skills to study physiology. I like nuclear medicine over radiology because I find physiology more interesting than anatomy. I am more interested in how things work rather than what they look like.
How did you reach this point in your career as a nuclear medicine physicist? In other words, what is your educational and professional background?
As I said, I was a physics major. I then went to a medical physics graduate program getting my Doctor of Science degree. Since graduation, I worked in nuclear medicine and PET at Georgetown University, Wake Forest University, and now at Children's Hospital Boston.
For whom would you recommend this career, or a similar one, in nuclear medicine?
I think my job is well suited to someone who is oriented towards mathematics, physics, and engineering. It certainly requires those skills. It also requires a desire to understand how these disciplines may be applied to biological and medical issues. I like the fact that I feel that I am using my skills in a way that is socially helpful. That is good for me. Also, as discussed above, it requires someone who can work with other highly skilled individuals.
Besides getting a higher education in nuclear pharmacy, nuclear pharmacists are expected to receive at least 500 hours of experience in ordering and receiving radioactive materials, because they are exposed to radiation by working with highly specialized equipment such as leaded glass and tungsten shielding, syringes, and so on. Also, certifications are not required for all nuclear pharmacist positions. However, they prove to potential employers that an applicant has the knowledge and skills necessary to handle radioactive materials responsibly. Thus, certification is highly desirable. A nuclear pharmacist is defined by the American Pharmacists Association as, quote, a member of the nuclear medicine team who specializes in procurement, compounding, quality assurance, dispensing, distribution, and development of radiopharmaceuticals. In addition, the nuclear pharmacist monitors patient outcomes and provides information and consultation regarding health and safety issues. End quote. The qualifications for a nuclear medicine pharmacist are not that different from those of medical physicists and nuclear medicine technologists. There are many colleges in which one can specialize in nuclear pharmacy. According to the University of Arkansas's nuclear pharmacy website, nuclear pharmacists often do not hold a special license to practice. They do need a license to use radioactive materials, however. Though the rules are different from state to state, this license is usually issued by the state of the National Nuclear Regulatory Commission. There are typical requirements for this. These include classroom training in certain basic techniques for handling radioisotopes, lectures and labs about several subjects such as radiopharmaceutical chemistry, mathematics of radioactivity, and radiation physics and instrumentation are typically required. Experience in handling radioactive material might also be required. A would-be nuclear pharmacist who is already a pharmacist could specialize in this through a certificate. Certificate programs can be found in many schools and institutions. These include Nuclear Education Online, UAMS and UNM, Purdue University, Ohio State University, Nuclear Medicine Associates, and the U.S. Army Residency Program.